there is something beyond just getting infected. You can move on with your life.
When I came to Wofak, I got people who were very happy, just healthy people. I asked one of the ladies that, are all these people sick or they're cheating? And when I heard their testimony, that was just became a healing to me.
After Wofak trainers, so different organizations see our potential, and they now using us, even including the ministry.
Filgona Atieno, a teacher by profession, characterizes the stigma people living with HIV are subjected to by society.
I was very thin, with glassy hair, rashes all over the body. So the head teacher said that I'll make the parents remove the children from the school. So they said that instead of that, I was to be retrenched, because they could not make them lose all the children. Before I was removed for retreat, I was assigned some duties in the washroom, to hide in the washroom, so that the parents, whenever they come to pick their children, they could not see me. But after the death of my husband, they managed to get a chance of retrenching me.
Stigma associated with HIV and AIDS greatly undermines the fight against the disease. This is because stigma cripples the best efforts to prevent and contain the spread of the epidemic, since it causes a series of negative beliefs, hypocrisy, and sometimes actions that can include avoidance and discrimination. The individual's intent to change behavior is also compromised by their dread of stigma and their perceptions of how these negative outcomes will affect their lives. It was on the premise of countering these negative perceptions that the Women Fighting AIDS in Kenya, Wofak, a non-governmental organization, was formed 2 decades ago.
Wofak was started in 1993 by a group of women who have been rejected because of their HIV status by their spouses, and this brought us together to start an organization or a support group for women who were actually rejected, to see how they could support themselves and also support those who are out there who had been diagnosed with HIV. And in 1994, we actually formally registered as an NGO, and from there the women never looked back. We started fundraising aggressively, and from there on, Wofak has grown to an organization that has about 9 centers countrywide.
Wofak's vision is for an AIDS-free society where women, youth, and children live with dignity. Its mission is to empower, provide care and support to women, youth, and children infected and affected by HIV and AIDS through community groups and organizations to enable them to have wholesome lives. Our core values are solidarity with the infected and affected by HIV and AIDS, transparency and accountability in all our actions, integrity, ethical practices and delivery of quality service, respect of diversity, the innate potential and dignity of people regardless of their HIV status, rights and justice for people infected and affected by HIV and AIDS. Wofak's image as a comprehensive care provider in Kenya is branded by its core activities, including prevention education to most at-risk populations, MARPs, general and treatment support for women, youth, and children, most of whom are infected or affected by HIV and AIDS, medical care services, nutritional care, OVC care and support through basic education support, feeding and food baskets for needy, orphan-headed households, vocational trainings for older orphans, and economic support for women and guardians from affected households.
We have seen stigma has gone down, especially amongst our membership, and they can actually talk openly. They have been able to be supported to continue with their work. Wofak has been giving income-generating activities, especially to women infected and affected by HIV, so that they can continue supporting the orphans and vulnerable children, and also ensuring that their livelihoods are improved.
Today, Wofak has programs in the Coast, Nyanza, Western, Rift Valley, and Nairobi regions. By the end of 2012, Wofak had reached out to approximately 50,000 persons, including 11,000 women, 2,000 youth, and 1,000 children, with comprehensive HIV/AIDS related services. It is estimated that Wofak reaches close to 100,000 people with information that promotes positive behavior change towards slowing the spread of HIV and AIDS.
We have seen quite a number of women who have gone through Wofak continue with their lives. They have moved on. Some have gotten married, some have gone to school, and even the stigma that was felt within the membership is no longer there. They talk openly and they go about their work as usual. So I can say from the time Wofak came into existence, a lot has changed.
Wofak continues to work closely with other care provider organizations in meeting the needs of the target population in recognition of benefits of partnerships. In Bumula, Wofak and its partners came to the rescue of an aged widow who is taking care of her 14 grandchildren after their parents died and then fire burnt down their house.
Ndali nimba angire mu bintu kate semba mai gini sipandi katomwa mamanyi mana nyumba eni rubukani ye biki mana ni bado ngao sabari.
We are here in the home of Josephine Oyuga. Josephine is a grandmother of 14 total orphans.
This is a case that was identified through the locational committees and then through advocacy by Kelin. This case of the grandmother Josephine was able to be picked up, and what we are here to do today is basically to support Josephine and her family.
We are here particularly to build for her a house, to also hand to her birth certificates for her children, and to hand over an identity card to her.
We work very closely with Kelin and Action Aid to ensure that if Wofak is not able to give the support that is needed, then we work with other organizations. And as Wofak, we have been able to train locational leaders and opinion leaders to help us identify these widows and orphans within the community. Today we decided to join Kelin, who help widows to build houses, because we also work with them. They have been able to train women in the community and also opinion leaders to ensure that the rights of women are taken care of.
The youth have also benefited from various income-generating activities.
In Magnet Theatre, we do several activities. One of them is advocacy on different issues, advocacy on behavior change communication, on the line to HIV. We also do advocacy on civic education. We also do advocacy on food security. Then we also do advocacy on girl child education, being the most the serious problem in the area.
So far Wofak tumekuwa tukipata pesa kidogo that inatusaidia, it enables us to angalie IGA. na venye IG yetu tunafanya saizi tuna keep poultry of which tumesaidika kutoka kwa Wofak. At the same time tuko na kashamba fulani around hapo juu ya mlima, tunafanya planting, tuna plant nyanya all those stuff. Sasa Wofak imekuwa kusaidia kufanya agriculture also by the time hatuna outreaches because kuna wakati tunakonga na msimu wa ukame kabisa. We don't have outreaches, so we depend on those things, the ideas ambazo tunafanya.
Nitaanza na introduction na community health workers kwanza kabisa.
Wofak maintains a strong team of 200 trained community health workers and volunteers who conduct the primary role of constant clients follow-up. The model adopted includes monthly technical update meetings with community health workers to discuss emerging issues and design relevant solutions.
We have been able to build the capacity of our staff, both staff and institutional strengthening. And as an organization, we are looking forward to seeing our affiliates supported in terms of building their capacity and ensuring that they continue with the service delivery that Wofak started 20 years ago.
However, Wofak fully recognizes the dynamism of modern organizational environment and is constantly looking at new, better and innovative ways of enhancing its capacity to fully meet its mandate in the area of HIV and AIDS. This change necessitates development of policies, plans and programs that can provide a strong foundation for Wofak to be an effective player in HIV/AIDS intervention, hence the launch of Wofak's strategic plan for 2013 to 2017.
We are very excited about the launch of the strategic plan, and that it is going to really make us be more focused in the work that we do as an organization. And the staff have also been able to have their hands in, they were involved in the process, and therefore they are actually acquainted with the activities that the organization is going to carry out throughout the country and not just within the head office in Nairobi. So it was a really participatory process with both our partners and our staff, and they are hands-on with the strategic plan. I think that is really, really important for us.
Wofak strategic plan is achieved through three main strategic goals. The first one is about equity, justice, and social protection for our beneficiaries who are definitely considered to be vulnerable groups. We are looking at women, we are looking at children, we are looking at the youth. Then secondly, our goal is to see an empowered community responsible for their development. Then the last strategic goal is to enhance access to comprehensive public service for people living with HIV and AIDS. You see, that's really where our buck stops.
Through the support that we have been able to get from development partners, we have come up with a book, Beyond Public Confession, and in this book we have 8 women who have actually gone through Wofak. They have been supported by Wofak, and they have moved on with their lives. And I think this is really something that is encouraging for people living with HIV. It's good reading, and it means that you really don't have to come to Wofak to get information. It is something that you can purchase from us and read and help other people, so that we don't have any more deaths, because we know HIV is manageable, and therefore we want to ensure that we don't have any more people dying because of the HIV infection.
At Wofak, we firmly believe that our partners will find renewed commitment to our purpose through the development of our strategic plan. It embraced diverse ideas, with the key goal being to capture the current and future needs of the organization in an energetic and systematic manner. The document is anchored on the principle that adoption of local and international best practices creates a modern, efficient, and proactive organization. This document is not an end in itself, but part of the continuous organizational effort to provide leadership in the area of HIV and AIDS, and more so in areas that have direct impact on the community's well-being.